Alright, today we're going to be doing a wound dressing change. It's going to be dry to dry. Before you do this, you check your MAR, you check your patient orders. You'll go and you'll get your dressings, any paste, any ointments or sprays that you need to do. Next, you'll gather those supplies, go in your patient's room, you'll clean your hands, sanitize them. Then you'll don clean gloves. You'll do that. And then, of course, you'll identify your patient using two identifiers, the date of birth and name according to their armband. Then you'll come up, you'll have this set up on a bedside table. You'll open your sterile field away from you. You'll move your sterile gloves out here, and then you'll open those up, and you'll take your saline, and you'll make sure you stay approximately 8 to 12 inches above, and you'll pour it into your sterile field, making sure not to splash it, make sure the saline is sterile. Next, you still have clean gloves. Make sure your sterile field is in your line of vision. You'll come up to the patient, check the site, check the wound, you'll peel off the old dressing, you'll clean it, you'll discard this. Next, you will note any drainage, any necrotic tissue, anything like that. You'll take off your clean gloves and discard them into the trash. Next, you'll go up and you'll get your sterile field and make sure you only touch the outer edge, the outer 1 inch of the sterile field. Then you make sure you only touch the very edge of your gloves. And these are sterile. And you'll put these on. You'll make sure that you don't contaminate. Put these on. Make sure you got your hands folded inside the gloves. You don't contaminate. Your sterile hand doesn't touch your skin. Now I'm sterile, and I'll come over here and I'll grab the gauze or Q-tips, whatever we're going to be cleaning with. It's a small one, so we'll just use Q-tips. Now this hand is no longer sterile, so I'll make one swipe and I'll discard that, and then I'll come over here and I'll make sure I'm not covering the same spot. I'm only cleaning new areas each time. I'll clean this outside edge, discard that. Once it's all clean, I realize that this is still unsterile. I'll use my sterile hand to place the new packing or gauze or dressing, whatever it may be, over here. And then I'll grab tape, and then I will secure it on both sides, and I can touch it now because the wound is covered with sterile gauze. And the outside, of course, is not going to be sterile. And I'll tape it on all 3 or 4 sides, whatever it needs to be for the patient. And then I will write my name, or my initials, and the date and time that I changed it, so the next oncoming nurse knows when to. Then I will document how the patient tolerated the procedure. I will document any drainage, any tissue, and how the patient's pain level was, anything like that, any other side effects or anything I should look for.